Hello and Namaskar. Welcome to the training session on maternal nutrition. I am Dr. Sumit Malhotra, Additional Professor at Center for Community Medicine, All India Institute of Medical Sciences, New Delhi. The topic for this session is delivering maternal nutrition services during antenatal care at ANC OPD. We will look at 1000-day window of opportunity framework, protocols for delivering MIYCN nutrition services during antenatal care period, and how it can be integrated in clinical practices. At first, let's understand 1000-day window of opportunity framework for improving MIYCN services in these facilities. These 5 facilities: first, antenatal care OPD; second, preparation room; third, labor room; fourth, postnatal care ward; and lastly, fifth, immunization and pediatric OPD care services as facilities where mother, pregnant woman seeks health and nutrition services for herself and baby throughout 1000-day period. A pregnant woman receives series of health services until her child turns 2 years at antenatal care OPD during antenatal care visits, preparation room on onset or early stages of labor, later immediately after birth at labor room, at postnatal care OPDs or wards during every day round, and at discharge and every visit to immunization clinic or pediatric outpatient department. Times at these health facilities are the opportunities within 1000-day period that we as healthcare providers can tap the mothers and her baby along with husband and other family members for improving nutrition services. As discussed earlier on the services, counseling on maternal nutrition and iron, folic acid and calcium supplementation and preparation for breastfeeding to be provided at antenatal care OPD and preparation room, encouraging early initiation of breastfeeding and kangaroo mother care, and counseling on exclusive breastfeeding to be provided in labor room and postnatal care wards. Counseling on complementary feeding and continued breastfeeding in immunization clinic and pediatric OPD should be done. Now we'll go through the service delivery protocols for delivering MIYCN nutrition services at antenatal care platform. Since you all are clinical practitioners and MIYCN champions, I hope you're already aware about the services that are provided to pregnant women. Let's look at recommended nutrition services during antenatal care period at first ANC visit. The first service is assess, measure, and identify women at nutritional risk. Women who are at first antenatal care visit are assessed and measured to identify who are at risk of nutrition or at nutrition risk. Anthropometric measurements like height and weight should be done, and body mass index derived to identify if she is underweight or overweight. Important clinical symptoms like pallor of conjunctiva, tongue, oral mucosa and palms, palpable goiter, and xerophthalmia or vitamin A deficiency should be done. Oral glucose tolerance test to be conducted and check for signs or symptoms for any underlying medical complications. Well, let's see now who is at nutritional risk. Mothers with age less than 20 years, height less than 145 centimeters, thin less than 20 weeks of pregnancy with body mass index less than 18.5 kg per meter square, mid-upper arm circumference less than 23 centimeters, overweight and obese women with body mass index more than 23 kg per meter square, anemia with hemoglobin less than 11 gram per deciliter, with gradient from mild to severe with severe less than 7 gram per deciliter, gestational weight gain less than 1 kg per month or more than 3 kgs per month from second trimester onwards, signs of night blindness, visible goiter, skeletal fluorosis in endemic zones, medical complications or associated infections like TB, malaria and HIV. Second service is counsel or prescribe. Counseling is an integral feature of the algorithm and a recommended service as per Government of India and World Health Organization guidelines. Counseling is provided to pregnant women and husband or family members on diet diversity and adequacy. Mothers should consume locally available nutrient-rich food from at least 5 food groups out of 10 recommended groups. Advice on malaria prevention in endemic areas and use of iodized salt. Appropriate management of anemia and oral glucose tolerance test as per national guidelines. Prescribe folic acid 400 microgram tablets to first trimester women for daily consumption for prevention of neural tube defects. Let's now look at recommended nutrition services during follow-up antenatal care visits when mostly women at second and third trimester visit. Measure weight followed by calculating and tracking weight gain. If the weight gain is poor, that is less than 1 kg per month or more than 3 kg per month, counsel on management of optimal weight gain. Do you remember the recommended average weight gain for pregnant women we learnt in our last session? Yes, it is 1.5 to 2 kgs per month from second trimester onwards. Check hemoglobin level for anemia and advise accordingly. Prescribe prophylactic iron folic acid supplements. These contain 60 mg iron and 500 microgram folic acid per day for all pregnant women starting second trimester for a minimum of about 180 days. Prescribe therapeutic dose of 2 tablets of iron folic acid for mild to moderate degree of anemia and do the necessary follow-up and appropriate management of severe anemia as per national guidelines that may require injectables or blood transfusion. Prescribe calcium 1 gram per day supplementation starting 14th week of gestation and single dose of albendazole 400 mg as deworming in second trimester. Assess dietary practices and advise on adequate and diverse diet, proper rest, and avoiding heavy work. Manage gestational diabetes mellitus as per national guidelines. Advise third trimester pregnant women on importance and benefits of breastfeeding, especially early initiation of breastfeeding after birth. Remind them to consume iron folic acid tablets with lemon water and not to consume iron folic acid and calcium tablets together and not take iron folic acid tablet along with tea, coffee and milk. Now we'll take a look at the protocol and understand the flow of services at antenatal care OPD. This is the protocol to be followed for first antenatal care visit. First of all, when a pregnant woman visits antenatal care OPD in the waiting area, a nurse checks if it is her first or follow-up visit. If it is her follow-up visit, then she follows another protocol for follow-up visit. If it is her first visit, then she is registered and her mother-child tracking system ID, which is MCTS ID, at some places we call this as RCH ID, which is reproductive child health ID, it is generated and it is given MCP card, which is mother-child protection card. Her weight, height, mid-upper arm circumference are measured. Her BMI is calculated, recorded to identify if she is at nutritional risk. Along with these, other measurements like blood pressure are taken as per antenatal care guidelines. She is then sent for laboratory investigations to test her hemoglobin and glucose tolerance test, etc. After she is sent to physical examination room, gynecologist or postgraduate resident takes obstetric and family history and records these on mother-child protection card. Then he or she takes a complete physical examination to see if danger signs are present and records all of these observations on the card. If danger signs are present, then they are managed and advised as per the danger signs. Then the doctor assesses her nutritional status by reviewing body mass index and 24-hour dietary recall and looks for any signs of anemia, whether they are present or not. After assessing if she is thin and or overweight or obese and or anemic, then the doctor takes in detail the diet and the medical history and arrives at possible cause or causes and prescribes and advises accordingly. Individual counseling must be given on adequate rest based on activity pattern, number of meals to be consumed, types of foods to consume from recommended food groups, regulate consumption of tea or caffeine products, tracking weight gain every month, protection from malaria by use of insecticide-treated bed nets, management of undernutrition or overnutrition through dietary counseling and modifications, management of underlying medical complications, and referral for specialized tests and services as appropriate. If thinness or obesity or anemia is absent, she is advised on adequate rest, importance of weight gain, increasing quantity of food or meals, and improving dietary diversity based on 24-hour dietary recall, folic acid consumption, starting iron, folic acid and calcium tablets in second trimester, consuming iodized salt, and maintenance of personal hygiene. Then she is prescribed tetanus toxoid and referred back to nurse and counselor who before exit repeats advice on rest, diet, weight gain, micronutrient supplementation and informs date for next visit and guides to immunization OPD for administration of tetanus toxoid and update mother-child protection card. Counselor reinforces all the key messages on benefits of healthy eating, importance of weight gain, dosage and benefits of iron, folic acid and calcium supplements, do's and don'ts while consuming this iron, folic acid and calcium supplements and side effects of iron, folic acid supplements. Let's look at the protocol now for follow-up antenatal care visit. First of all, when a pregnant woman visits antenatal care OPD in the waiting area, the nurse checks if this is her first or follow-up visit. If it is her follow-up visit, she confirms mother-child tracking system or MCTS ID or reproductive child health RCH ID. Then her weight is measured again, but this time remember, her current weight is compared with the previous weight. And as we mentioned earlier, weight gain less than 1 kg or more than 3 kgs in a month is considered a warning signal. After this, she is sent to physical examination room where gynecologist or postgraduate resident ask for any current complaint or past difficulty in following advice from previous visit. If she has complaints, then gynecologist or postgraduate resident probes the details and addresses concerns related to diet, iron, folic acid, calcium supplementation or any other complaint. The gynecologist then reviews changes from previous visit, completes physical examination, screens for any danger signs. In case of danger signs are present, they are managed and advised as per presence of these. In case of absence of danger signs or the danger signs are managed, then the gynecologist assess nutritional status by reviewing the weight gain, hemoglobin level, and 24-hour dietary recall. If a weight gain is optimal and there is no presence of anemia, then she and her family members are advised on continuation of iron, folic acid, and calcium supplements. She is advised to eat adequate diet, that is diverse, and appreciate her for continued optimal weight gain. Along with this, if she is in third trimester, she is also advised on benefits of early and exclusive breastfeeding, birth preparedness, and family planning options. If her weight gain is suboptimal or excess or presence of anemia, then the gynecologist reviews previous records and probes for diet and other reasons to arrive at possible causes and provides counseling based on history on the topics as the first protocol. Then she is prescribed second dose of tetanus toxoid, iron, folic acid, and calcium supplements, deworming if she is in second trimester, and informs date for next visit. Before exit, nurse repeats advice on rest, diet, weight gain, micronutrient supplementation, and next date for follow-up visit is informed. Guides to immunization OPD for uptake of second dose of tetanus toxoid and updation in mother-child protection card is done. Counselor reinforces all the key messages on benefits of healthy eating, importance of weight gain, dosage and benefits of iron, folic acid, and calcium supplements, do's and don'ts while consuming iron, folic acid, and calcium tablets, side effects of iron, folic acid tablets, reminder for follow-up visit, and counseling on breastfeeding to those at third trimester.